State lawmakers have been talking about federal funding cuts for months, with some expressing concern about the impact on state budgets and programs.
22 News State House reporter Olivia Ray explains the impact of cuts that are on the brink of being approved in D.C.
In Washington, Congress is working on passing a bill that would cut hundreds of billions of dollars in federal spending. Here in Massachusetts, it could be catastrophic. The bill is before the U.S. House Committee on Energy and Commerce, and it seeks to reform how Medicaid works through new minimum work requirements for recipients and limits on allowing states to tax providers to help fund local programs. The direct impact on Massachusetts would be enormous, leaving hundreds of thousands of Bay Staters without health insurance and making creating the next state budget far more complicated. On the budget creating end, Mass Health is the largest line item in the spending plan draft at $21.5 billion last year, and the state is counting on over $14 billion of that funding to be reimbursed by the federal government this year. Any cuts to this number would require lawmakers to scramble to pull funding from other essential services. Republican supporters of the bill say it's intended to reduce fraud and make Medicaid work better for those it is intended for, legal citizens with high levels of need. Democratic opposition includes Governor Healey, who signed onto a joint statement with 22 other governors, saying, quote, "The notion that states will respond to massive cuts to federally appropriated dollars by backfilling with state resources is simply inaccurate and impossible." Legislative action on this bill can be expected by Memorial Day. Protesters at the committee hearing in Washington chanted no cuts to Medicaid so loudly it could be heard through the live stream feed here in Massachusetts. Working for you from the State House in Boston, I'm Olivia Ray, 22 News.